Welcome to Clyde Ellis Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Clyde Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Welcome, Cassie. Thanks for joining us on Medically Speaking today.
Happy to be here. Thanks for having me.
So I know these are tough times with the coronavirus and this current public health crisis. Nonetheless, as a hospital, you guys have to continue to run day-to-day operations. And part of that includes labor and delivery, in particular dealing with expectant moms. So if you can, talk a little bit about what the environment is right now and some of the risks or questions that you guys are getting.
Well, you said it perfectly. I mean, we still are very proud and are actively delivering babies every single day. There have been a lot of questions that have come to us from the community about safety for the pregnant woman out in the community. And the best thing we can say is do what we're recommending for everybody else. Wash your hands, socially distance, really focus on taking care of you. A healthy diet, sleep habits, and all of those great things will really help you protect you and your family from the virus. In general, pregnant women are not shown to be at any higher risk than the rest of the population. But obviously, worrying about that infant is key in everybody's mind. So we've done a lot of work with our team on ensuring we have the safest workflows from a cleaning standpoint, a workflow provider standpoint, and making sure that we are ready for caring for each and every one of you.
So Cassie, in the middle of all this, mom comes into the hospital, she delivers. One of the questions you guys, I'm sure, are having to deal with is it safe to breastfeed, knowing that people think that there's a higher risk at this point. So talk a little bit about that.
Yeah, in general, whether the woman having the baby is coronavirus positive or not, our number one priority is everybody's safety. So if a woman happens to be positive or is being worked up for coronavirus, we not only recommend breastfeeding, but we help them do it safely. So the woman during breastfeeding would have to wear a mask. If she decides to pump because she's worried about any additional risk, then we would walk through all of the appropriate hand hygiene and cleaning of the equipment to ensure that the baby gets the breast milk. The beauty of breast milk is that it will have antibodies in it. And so it is absolutely the best thing a mom can do for her newborn, whether or not we have a pandemic.
Sure. So probably almost 2 weeks ago now, the hospital instilled or implemented some restrictions in terms of visitations. Tell us why you guys did that and what that means.
We restricted visitation to really keep our staff and everybody coming to the hospital for services safe. So the concept of social distancing applies even in a healthcare facility. So whether you're standing 6 feet apart from somebody at the grocery or you're thinking about crowd control, we need to think about that in the hospital. So by reducing the number of people coming into the facility, we are therefore making the facility safer and the experience safer, but we still need mom to have a support person. So whether that is the father of the baby or maybe grandma, we still want somebody to be there with them to help them through the birth experience and to really enjoy those first moments of a new baby's life. And similarly, we have a partnership with Jericho Road. So for those mothers out there where English is not their first language, we are still using the Jericho Road partnership and their doulas to help us interpret less known dialects around the world.
Sure. And I know in New York City, there's been some a little bit more extreme measures taken when it comes to restriction in terms of no visitation. Only mom is allowed at this point. So is that something you guys have talked about or looked at? I know we fielded some questions via social media on that issue.
We have looked at the articles coming out of New York City and the reasoning why, but we feel very strongly that the partner in a birth experience is more part of the care team than a visitor. So we are not moving that way at all.
Great. So last questions, talk a little bit about some of the education that you guys traditionally do and how that's changed with this current pandemic. So the childbirth education, things like that. What are you guys doing as a change in practice right now?
Well, again, just in an effort to keep everybody safe, we are still offering childbirth classes and tours. We're just doing all of them virtually. So our childbirth classes are available on our website via Zoom. Everybody can register in the same fashion that they used to and are certified, Childbirth Educator will be doing that education. And we will have virtual tours of our maternity unit posted this week and our NICU either this or early next week.
Great. Well, I know you guys at Children's have been through an awful lot the last couple of years. First with the big move from Bryant Street over to Ellicott Street. So I know you guys are ready for this current issue you guys are dealing with. So thanks for all that you guys are doing. Please make sure you thank your nurses and physicians from us.
Absolutely. We're very, very proud of our team, and I'm lucky to work with everyone that I do on a daily basis. We are ready to keep our community safe. Thank you.
Right. Thanks for coming on today.
My pleasure.